Hello, everyone. We are going to come back together and continue our forum today. First, I want to thank everyone for being here, and for all of you who are visitors to the university today, extend a very warm welcome to you. Welcome to UT Dallas. I am Erin Doherty. I'm the Director of Development for the Center for Children and Families, and that means my job is to secure the resources that the center uses to accomplish its mission. And I'm also a parent of 3 young daughters, so that makes me one of the center's very biggest fans. I want to be really brief and direct out of respect for the work that we do and so that we can continue with the discussion, and also say this with a lot of gratitude for everyone who's here in this room who helps to support the center. The Center for Children and Families accomplishes its mission, which is to advance the healthy development of children in our community and our nation through research, education, and outreach. Some of what that looks like is we operate 5 playful learning programs called Play With Me or Juega Conmigo in Dallas, Richardson, and Plano. We provide developmental screenings and follow-up services throughout the year. We offer educational opportunities for our community through this annual forum and through an outstanding spring lecture series. I hope you all come back to UT Dallas to see that. We also teach UT Dallas students in a number of ways, including our service learning course. Through this outreach, we focus on doing 3 things very well. We are focused on educating the next generation of parents and practitioners and researchers, on advancing research in child development, and on translating that research into actions for our community and for our nation. I want to invite you to support the work of the center by making a gift. If you are interested, there are these reply cards and envelopes on your tables. You can also give online at giving.utdallas.edu/ccf. I just want to share with you what a huge difference you can make through investing in the center. Consider this. A gift of $84 provides a Play With Me session for a parent and their child. $100 helps us to cover the cost of sending child developmental specialists out to offer Play With Me courses. $250 is enough to cover the cost of the center for providing a developmental screening and follow-up services for an at-risk child. $1,000, it covers the entire cost of a parent and their child going through the entire series of Juega Conmigo classes. And you can also make gifts that would support the research, like you heard today from our outstanding affiliated faculty members, or to support scholarships and fellowships for some of UT Dallas's truly incredible students. Your gift is an investment in the lives of the children and the families that we serve, and in the students who will be our future policy leaders and our future practitioners and future parents, and in the research that advances what we know about child development and family development. So if you have any questions, or you'd like to turn in a gift, or you'd like to talk more about the Center for Children and Families, I'm going to be outside at the information table and hope to talk to you. And now I'd like to invite Melanie Rubin to the stage. Melanie is director of the Dallas Early Education Alliance. She works with the Dallas Home Visiting Coalition and is chair of the City of Dallas's Community Development Commission. And most importantly, she is a leader for the Center for Children and Families as a member of our advisory council. Melanie's going to introduce our next speaker. Thank you.
It is my true pleasure to introduce Dr. Kaylee Benson. I've had the privilege of seeing Dr. Benson use her keen research skills and depth of knowledge to directly improve policy for Texas children. Dr. Benson earned her PhD in Human Development and Family Sciences at the University of Texas at Austin. She currently provides oversight and guidance to family projects at the Child and Family Research Partnership at the LBJ School, my alma mater, at the University of Texas at Austin. Prior to this work, Dr. Benson worked as a research assistant at the Yale Child Study Center and at the Texas Kids Count Project at the Center for Public Policy Priorities. Most importantly, Kaeley is also a new mom to 6-year-old Charlotte. We are all in for a treat today to get to learn from Dr. Benson. Clearly extremely bright and accomplished, she is uniquely effective in using her head to speak from her heart. Kaeley is especially articulate and makes complex research accessible to service providers, policymakers, and the community to drive change. Please join me in welcoming Dr. Kaylee Benson.
Thank you, Melanie, for such a lovely, lovely introduction. And thank you all for having me so much for having me here today. I am absolutely delighted to be here. This is my first time at UT Dallas. I have a lot of family who lives down the road in Arlington, so I'm up in this area quite a bit, but it is so nice to be here. I have enjoyed what I have heard so far this morning. I feel like these are my people, and I love being at events like this. I have, as Melanie mentioned, I have been working in this space for over a decade now. I have been in Texas for 11 years. I moved to Texas to do my doctorate work at the University of Texas. Did a little stint at the Center for Public Policy Priorities working on the Texas Kids Count project, which I'm going to share some data from that. And then for the last almost 6.5 years, I have been working at the Child and Family Research Partnership, which is at the LBJ School of Public Affairs at UT Austin. So from graduate school to current employment, I just had to walk across a road down in Austin, and so that was really nice. But Texas kids and the challenges facing Texas kids have always been dear to my heart throughout the last decade or so that I've been in Texas working in this space. But I will say that this little nugget is now is my own Texas kid. She was born in May, and so the issues and challenges facing parents and families with young children really have kind of a new meaning and sense of purpose for me now. This is Charlotte. She's actually made a couple appearances over the last few minutes, which I don't know. I feel like she's like, "Mom, come home." I'm coming. It'll be fine. American Airlines better do well. So the way that I've structured this presentation is a little bit of like a bad news sandwich. So I start off with some good stuff and then kind of go through a lot of the issues and kind of big picture challenges facing our kids in the state of Texas right now. But then I end with some more good news and kind of I'm going to walk you through some of the things that Texas is doing as a state to actually start trying to support our families and children, which is great. But of course, there's always more to do, and I look forward to a good discussion about that. So, Texas strengths. We have a lot of people in this state, which is a good thing, which means we also have a lot of kids in this state. So 10% of kids in the country live right here in Texas. Texas accounts for half of the growth in the child population right now. So how Texas kids are doing doesn't just matter for Texas. It matters for the country. It reflects how the country is doing for its kids because we have so many kids in Texas. We also have a booming, strong economy. And everything is bigger in Texas, as they say, as I've learned over the last several years. But I would argue that bigger is not always better. So Texas ranks 47th out of 50 in state spending per resident. And as it would follow, we rank 41st in overall child well-being. We always like to give a special shout out to our really good friends in Oklahoma, West Virginia, Alabama, Alaska, Arizona, Nevada, Mississippi, Louisiana, and a real big shout out to New Mexico. They always really cushion us from the very bottom. So, thanks to you guys. Child poverty in Texas. We are 38th overall in the percent of our kiddos who live below the federal poverty line. In 2018, for a family of 4, that was just under $25,000. That's the federal, that is what it means to be in poverty. 1 in 5 Texas kiddos lives in poverty, lives in a family with an income in poverty. That is not equally distributed across race and ethnicity. For our white and Asian children, it's about 1 in 10. For our Black and Hispanic children, closer to 1 in 3. So these are data points pulled from a special, my first baby, Texas Kids Count. These are 4 kind of domains of child well-being that I'm going to go through in a little bit more detail. But if you think of children's economic well-being, their education, their health, family and community factors, it's not looking very good. We are somewhere between 30th and 47th. So economic well-being includes things like poverty, kiddos who live in families where no parents are employed, where parents have to spend more than 30% of their income on housing, and disaffected youth. And so this is not so much our littles, but these are going to be our teenagers who are under age 18 but are neither working nor in school. Education. So over half of 3 and 4-year-olds in the state of Texas are not in preschool. 71% of our kiddos are not proficient in 4th grade reading, according to the federal U.S. Department of Education test. And similarly, over 2/3 are not proficient in 8th grade math. Now, I will say, the reason why we are 30th and not 50th in this is because the country as a whole is not very good on these metrics. So on average, roughly 2/3 of kids across the country are going into 4th grade not proficient in 4th grade reading. Massachusetts is the best on this, as they're like always the best on all the metrics. Whatever, Massachusetts. You and all your funding. Massachusetts is just over half. So just about half of Massachusetts kiddos are proficient in 4th grade reading. So this is exacerbated in Texas, but this is not just a Texas problem. Health. 39th overall in health. 8.4% of births in Texas are low birth weight, and we know the challenges associated with low birth weight babies in terms of their long-term trajectories. Child and teen death rate, 27 per 100,000. 11% of our Texas kiddos do not have health insurance. We are 50th. We are dead last. We can thank nobody for that one. We are the absolute last in insuring our kids. Teen substance abuse, 4% of our teens. Family and community. Over 1/3 of our children are living with a single parent. Roughly 20% are living with a parent who does not have a high school degree. 15% are living in areas of very high, dense, concentrated poverty. And our teen birth rate in this state is particularly high, 28 births per 1,000 teen females. Texas is also usually 49th or 50th in repeat teen births. So our teen birth rate is high, repeat even worse. Again, 47th in these types of factors. Thank you, New Mexico, Mississippi, and Louisiana. And we know that poverty is not good for kids. It causes chronic levels of stress for families, which affects parenting, and all of the inputs that we've been talking about this morning that go into kids early on are all affected when parents are stressed and families are living in poverty. We also know that exposure to chronic stress harms early brain development and really shifts the trajectory for long term. It affects how kids respond to stress and how they respond to adversity. And we know that children in poverty show up to school less prepared to learn. We've also talked about that this morning. Child poverty is associated with hunger, poor school achievement, juvenile justice involvement, teen pregnancy, lower employment, lower earnings, higher illness, and early death. We also know that these disparities show up really, really early. Now, you all don't know me very well, but I am a self-proclaimed data nerd, and I don't know if you have a favorite bar chart, but this is my favorite bar chart. Not because it shows because it shows good news. It actually shows really bad news, but it just very clearly shows the problem. So on the left is cognitive development. On the right is positive behavior. And the yellow bar is 9 months of age. The blue bar is 2 years, 24 months. And at the top is basically the average score for cognitive development. They're using an assessment called the Bailey. So the top of the bar graph, where it says 0, is the average score on the Bailey, an assessment of cognitive development, for children living above 200% poverty, so higher income kiddos. What that bar shows you is that by 9 months, kids who are living in lower income families are already, these are all significant differences. By 9 months of age, children who are living below 200% poverty are already 0.2 standard deviations behind their higher income peers in cognitive development, and that is already at a whole half of a standard deviation by 2 years. Just know that that's a really big deal. And you see a similar thing with positive behavior. A similar trend for cognitive development happens with behavior as well. So our kiddos who are growing up in below 200% poverty are already behind their peers at 9 months, and it just continues to get bigger at 24. We also kind of talked about this idea of the Matthew effect earlier. So this is really showing that. All of this, the fact that early poverty has really long-term disadvantages for children, and the fact that those disparities show up really early, really provides the case for early intervention. So this is probably like my second favorite graph. This is actually not even based on real data. This is from James Heckman, who is an economist and Nobel laureate, who showed economically that if you invest early, you get the best bang for your buck. Now, developmental psychologists have known this for like forever, like brain science, right, James Heckman, we know. But because an economist was able to show it and that it was financially sound, now it's like, oh, okay, maybe we should invest early. So this just kind of shows you that investing early, prenatally, that really critical 0 to 3 period, what it does not show is that investing at any time, you should invest at any time. Like, you're gonna get some return. It's important to support children at any point. But if you can get to families early, you're gonna get a better return. You're gonna be able to shift that trajectory. It's easier to shift a trajectory when it's very narrow and at the beginning versus when it's already this far apart. So at the federal level, there are a host of different policies that are aimed at trying to increase the income and provide supports for families who are in poverty. And this is a little bit of a complex bar chart, but this is from one of the recent National Academies of Science reports, a roadmap to reducing poverty. And what they looked at is at all of these different policies and programs and supports for families, how much does it reduce poverty? And so we can kind of just focus on the first 2 bars, and you can see that with all of those programs, it reduces child poverty quite a bit, kind of down to about 13%. But it doesn't totally eliminate them, right? So our programs are helpful at the federal level, but they don't make poverty go away. So the good news, Texas is doing stuff, which is great. This is like, okay. Actually, a lot of these just came out of the most recent legislative session. So yeah, this is a big deal. So what is Texas doing about this? What is Texas doing to try to support our littles and our families who are struggling? The first is the Texas Home Visiting Program. And I want to start with Texas Home Visiting Program because I have been evaluating the Texas Home Visiting Program for what seems like the last 2 decades, but really, I guess, only the last 6 years or so. But this is a federally, or it originated as federal funding through McV, which is the Maternal Infant Early Childhood Home Visiting Program. That was originally a part of Obamacare. So this was 2010. And the feds gave over $1 billion to states to implement home visiting programs. And these are 2-generational programs that support families prenatally up to age 5. And it's really targeting parents' ability to promote their children's development and to support and give parents the skills to support their parents. And the way that they do this is that they actually send professionals or paraprofessionals into the home and to really work with families in their home. There are several different models of home visiting programs, and they vary widely in terms of what age, the age of the children that they target, and how the level of risk that families must have. Some target families who have a history of child abuse and neglect. Others target low-income, first-time moms. Others, you have to have meet at least 2 or 3 different types of risk factors in order to be eligible for the program. How long the program is varies widely. And they are being funded and implemented widely because they've been shown to work. And home visiting is really leading the way in this idea of let's fund what we know works. Like that's a great idea. And so with the large federal funding, the federal government also funded a huge review of all of the evidence, and that is ongoing. But it has shown that several of the home visiting models, they have positive effects that include improvements in child and maternal health, parenting attitudes and behaviors, cognitive and social emotional outcomes in children, reducing rates of child abuse and neglect. Now, the average effect sizes here are typically small, and which programs produce which impact varies widely as well, but this is promising. I'm not going to go through all of these, but just to you can just kind of see that there are a host of different ways that we've measured child outcomes and how home visiting programs affect child outcomes. And on the right side are all of the different program models, and these are all within Texas that have been shown to produce those outcomes. And this is similar slide, but for parenting outcomes. So including parent-child interactions, providing stimulating home environments, a lot of the things that we were talking about earlier that are really important for kids. These programs can help provide parents some of the skills to do that. So home visiting in Texas, these data are officially, as of yesterday, outdated because they came out with the 2008 or 19 yearbook, and I was like, I can't change the slides, I'm sorry, because it's too late. So in 2017, we provided over 200,000 home visits to parents in the state of Texas. This includes all of our federally funded home visiting programs and all of our state-funded home visiting programs. We've served over 15,000 families and nearly 18,000 children. This was 2017. Despite that, there are a lot of children and families in the state of Texas that could benefit from these programs. So roughly 2.3 million children in the state, based on their age and income, could potentially benefit from home visiting, and that is roughly about 1.7-ish million families that we just aren't quite reaching. And that's not to say that all of them would benefit from home visiting, but they could potentially benefit from home visiting. So just to kind of put into scope, we are doing a lot with home visiting, but it is not the answer. It is not our silver bullet. It is not the answer because we can't serve all of the families that might need it. And then this is just kind of showing that of all of those families that could potentially benefit, about half meet some sort of risk criteria, and about a quarter meet 2 or more risk criteria. So maybe like half of that number would be kind of your potential population for home visiting programs. What else is Texas doing? Texas is funding, as of hot off the press of 2019 legislative session, full day pre-K. So this was a part of HB 3, the Texas School Finance Bill, which now requires districts to provide full-day pre-K to eligible 4-year-olds. And eligible 4-year-olds, this is our Texas pre-K, which is particularly geared towards lower-income families, English language learner families, military families. There's a host of vulnerable or target populations that the state focuses for our Texas pre-K program, but it has up until this point only been half day, which is not a particularly good support for families who work. Now it requires all pre-K programs to be high quality, but unfortunately, it does not establish class size limits or maximum student-teacher ratios. So this is really important because while getting kids into pre-K for a whole day is a really, really good thing and a big deal in Texas, we want that experience to be high quality, and Texas doesn't do a very good job of enforcing or regulating quality, particularly for pre-K. We don't really do a good job of it with childcare either, and I'll get into that later, but like we don't do anything for pre-K. And so, you know, we're making a good step forward, but there is a lot of room here where we need to really continue to push the state and to make efforts to really make sure that now that we're giving our kids the chance to be in, our 4-year-olds to be in school all day, that experience is of high quality. And importantly, it did in HB 3, it does require school districts to develop early childhood literacy and mathematic plans in order to improve those skills explicitly. Increasing oversight of childcare is something else that we're doing. I will say that I have a little bit of extra context for this. Partly, we're increasing oversight of childcare because we didn't really do a good job of oversight of childcare to begin with, and so increasing it is good, but we were kind of starting at a little bit of a low bar. And I will say that part of what happened in this last legislative session regarding childcare oversight was the impetus for that was a really powerful 12-part investigative series out of the Austin American Statesman called Unwatched that highlighted the fact that since 2007, 90 children have died in our child care centers from child abuse and neglect. I will say that this came out in December, which was like right around the same time I was touring childcare centers for my soon-to-be child, and I probably almost quit my job like 27 times while all of this was going on and reading this, and I was like, I can't do it. My husband said no. So here we are. I'm here today. But because of that, at least 11 bills were introduced in this last session to deal with this, or to attempt to deal with it. I'm just going to go over a few of the highlights of what passed. SB 568 ensured that more information on child care centers histories of safety, so their safety records, that more of that information is available to parents. SB 569 increased oversight for what we call listed family homes, so these very small in-home child care operations. SB 706 reinstated an investigative unit within the Health and Human Services Commission to actually seek out illegally operating child care that had existed and then went away, and they brought that back. And then SB 708, which is particularly dear to my heart, directs the Health and Human Services Commission to actually collect data on caregiver-child ratios and group standards and subsequent violations and injuries reports. So in that Austin American Statesman piece, one of the pieces was about a study that the Child and Family Research Partnership had attempted to conduct in partnership at the time with the Department of Family and Protective Service, who at that time was overseeing child care licensing. And we were really just trying to link the ratio in a child care center to the safety and reports of violation or ratio violations and reports of injuries and safety issues in the child care center, with the hypothesis that better ratios would equal better safety. And I thought going into the study that surely the state collects information on ratios, right? I mean, they collect information on whether the center violated a ratio, so somewhere there's ratio information. Turns out, no, they actually don't collect or report information on the ratio in a given center or any child care operation. So we, in partnership with the state, had child care licensing reps go out, and when they were doing their annual or periodic licensing inspection, they just, instead of like writing the numbers down on a sticky note, just entered it into into a survey. And we actually found that centers with lower ratio or with better ratios, sometimes it's hard to know like lower or higher, is that better? So I try to say better ratios, fewer children to a teacher, was linked to better safety. And so we are hoping that that study got cut short, really short, for a number of reasons. But SB 708 will kind of bring that study back. And whether we do it or the state does it, TBD, but I think collecting the information and drawing that link and making that link explicit will be really important for childcare. Increasing funding for early childhood intervention. So ECI, we've talked a little bit about that today in some of our discussion. Statewide program for families with children 0 to 3 are really early, are really tiny, tiny littles who have disabilities and developmental delays. In 2019, the Texas legislature increased ECI funding by $31 million. This was, of course, less than half of what the state had actually requested, but it's the largest increase that ECI has had in years. So that is one half step forward, so that is good. Reach out and read. I don't know if you all are familiar with this program, but we have a Texas chapter, and this is I love programs like this. So Reach Out and Read Texas is a part of the Children's Learning Institute, and it pairs the importance of reading with pediatric facilities. So where are kids? They are inevitably in that first year for sure going to be at some doctor, because if my child is any inclination of how kids are, they are sick all the time. So at some point, they are probably in some sort of clinic, some sort of medical entity. And so what this program does is it encourages pediatric medical providers to talk to parents about the importance of reading to their kids. It actually provides parents with a book for their kid. And it actually it restructures the waiting room a little bit so that it is more inviting and has opportunities for reading and books and time while parents are reading with their kids, or waiting with their kids. They can be reading with their kids. And this serves 300,000 children annually, which is kind of cool. And so I really love programs where they go to where the kids are. So we know the kids are probably going to be at the doctor at some point, for better or for worse. So let's figure out how we can, like Kathy was talking about earlier, they're going to be in the grocery stores, they're going to be at bus stops. How can we reach kids where they are? So this is a great example of that as well. Statewide collaborations and strategies. So Texas is actually doing a lot at the statewide level across state agencies to support families and kiddos. And I'm not going to go into all of those, but I do want to highlight a few. And one of those is that Texas is now officially a Pritzker state. And so back in April, the Pritzker Children's Initiative funded 11 states, including Texas, with planning grants. And the purpose of these planning grants is to establish coalitions of state partners, state and community partners, to develop a policy agenda to support healthy development. And so the three big groups that are really taking the lead on our work in the state of Texas are Tex Protects, Children at Risk, and Texans Care for Children. And this is just a really, really cool thing that we are doing. We are a Pritzker state, and the work that these three organizations are leading in collaboration with a ton of other different community partners and state partners is really, really, really cool. We are also in the process, I say we use very loosely, not me, or CFRP, but TEA. We are in the process of applying for a preschool development grant, birth through 5. So in September, the U.S. Department of Education came out with their notice of funding announcement for the next year's funding of preschool development grants. And so TEA is working with several other state agencies, including Prevention and Early Intervention and Texas Workforce, to put together this application to get this funding. Simultaneously, both Title V, which is our maternal and child health block grant, and MCV, which is the federal funding source for a lot of the home visiting programs happening in Texas, both are requesting needs assessments from the state. So Texas is undergoing conducting two separate needs assessments, one for Title V, maternal and child health, one for MCV. And these are always really great opportunities to get input from the folks on the ground in the communities who are actually the ones working with families and providing services to families about what the community needs are and where our families are. And so those are ongoing currently. And then finally, just a shameless plug, the Prenatal to 3 Policy Impact Center is a new initiative, actually also funded by the Pritzker Children's Initiative, that will be housed at the Child and Family Research Partnership down at UT Austin. And we are working to stand this center up. So we are in the very beginnings of standing the Policy Impact Center up. But the overall goal of the Pritzker Children's Initiative and of the Policy Impact Center is to ensure that children are on track for healthy development by age 3. And they have a separate kind of overall mission, the Pritzker Children's Initiative does, PCI, of reaching 1 million low-income 0 to 3 kiddos by 2023 through high-quality services and other opportunities. And there's 3 big areas in terms of how we promote healthy development for kids, and that is healthy beginnings, that infants are born healthy and continue to thrive, that they grow up in families who are supported and have the resources and skills that they need to support their child's development, and that they have access to affordable, high-quality childcare options. And so kind of our big plan with all of this is we are conducting comprehensive and systematic reviews of state-level prenatal to 3 policies. So think about policies that intersect families from pregnancy through age 3. So things like expanding Medicaid, paid family leave, a lot of our state our financial support programs like the state EITC, SNAP, WIC, our access to childcare. So are our childcare safe? Childcare ratios. How well are our childcare providers paid? What are their qualifications? How high is the quality? So all of these policies that exist and that intersect families during that prenatal 3 period, we are reviewing to try to answer the question, are there a set of policies that are really effective at moving the needle in this time period? And I'll just give you like a tiny little teaser, which is that we have a lot more research on programs than we do on actual policies. And so we went into this thinking like, oh yeah, we're gonna find all the things, we're gonna come up with this list, and it's gonna be really easy, blah, blah. It's really, this has turned into be quite the challenging proposition to find rigorous evidence on policies and then evaluating outcomes specific to families during that prenatal 3 period. So anyway, so we are working on that. We are doing that right now. In conjunction, this is a national initiative, so we are making connections with prenatal 3 folks, leaders, stakeholders, state agency leads, legislators across the states to build those connections and be able to connect states with each other. We're going to be developing a roadmap, which will actually provide information to states on not just how they're doing. So a lot of the data I showed earlier from Texas Kids Count is you're doing really poorly, Texas, right? Like you're always in the bottom 10 states, but it doesn't give Texas like, how do you get better? How do you not be in the bottom 10% or 10, not 10%, bottom 10? And so what our roadmap, what we are intending to do with that is to actually have it be a roadmap, like have it be a path forward. So here's where you are with policies and supports during the prenatal to 3 period, and here's how it's going, and here's what you need to do to keep going. Yes, okay, I think that's the prenatal 3 Policy Impact Center. Just a little new thing. Okay, so we have big challenges in Texas, but we also have big opportunities too. Texas is a really great place for business, we know that. It's not always a great place to be a kid, but Texas is actually making some pretty big steps toward supporting the future of Texas. We've got home visiting. We now have full-day pre-K for our 4s. Stronger regulations for childcare. We're assessing needs in our communities. We're planning for the future. But there's always more to do. And in all of those, in all of the steps that we're doing to support families, there's ways to make those steps better. But you have to take a step forward, and I think we should all be appreciative that we are at least taking some steps forward, despite the fact that there's always more to do. Okay. Questions?
So in your final slide, you said this is a great place for businesses.
Yeah.
And this Dallas metropolitan area certainly is. We recruited huge corporations to this area recently. So are any of the agencies trying to work actively with the businesses that are coming in to try to get them to invest in children in the state? Because these are the children that are going to grow up to be their workers. And so that's just my... Yeah.
You are 100% right. I don't know what the state is doing necessarily to, like, state agency-wise. I think that all of the really wonderful community-level coalitions that exist in all of our cities are really actively trying to engage that business component. But you said it very well, because I've heard somebody say it the other day. We have a ton of people moving to Texas from California, and we're basically reaping the benefits of how California is investing in their kids we're getting them as adults, because our own children, right, are not perhaps not the best prepared to be our future workforce, right? Like, this is an actual, this is what is happening. And, you know, I think, to me, it makes perfect sense. I think to everybody in this room, it makes perfect sense that invest now in your future workforce, right? These littles are going to be getting jobs in 2 decades-ish. You know, the problem, more so for legislators, I think, than business folks, is that it's just the waiting game, right? It's like, I don't get my return now, and you know, that's how I'm held accountable on, you know, on an election cycle. But I think more and more businesses are seeing this, and you know, to answer your question, frankly, I don't quite know what the state agencies are doing. I completely agree that they should, and that, like, that is the perfect framing, and I fully support it 100%. And it makes sense to me, and I'm sure it does to all of you. But how do we message that, I think is, and how do we get that buy-in? Right. Yeah, definitely. Does anybody have any thoughts on that?
Toyota, it's a national program,
Yeah.
but it's here in Dallas. And agencies could apply for a grant, and it's a family learning grant, and they are really going into, ours is school, Momentous Institute School, working with low-income families, teaching a lot of the things that you're talking about, but also helping parents become advocates in their community for what they really want and need and see as needs that they can address, and helping them learn how to work together in that. And then the plan is that after this year's cohort, that those parents continue with this, but also train other people in the community. And it's, in our school, parents have just blossomed. I mean, it's been wonderful. So Toyota's really doing a national program, and Dallas has a big contingency here.
That's great.
I think that there are some local champions. Thank you. I know PepsiCo is also investing a lot in certain areas in Dallas, and I think a lot of this corporate work is happening on the local level. I know, coming from Dallas, I'm not supposed to promote Tarrant County, but I will tell you that they are doing an amazing job of, they're having a campaign right now of making Fort Worth the best place to raise children, and really looking at engaging the corporate community as a corporate community rather than these individual leaders. So I think that the thinking is happening there. I think you're exactly right. Not necessarily at the state agency level, but I think we're getting there.
Yeah. It's so important.
Good? Yay. All right. My question relates a bit to the interface of the home visiting program that you talked about, as well as the early child intervention programs in Texas. It sounds like, so my kind of background coming into this is I did EI in Massachusetts.
Okay.
And I'm trying to kind of frame how it is here. It sounds like EI doesn't qualify based on risk factors here. Is that true? Or-
ECI? Here?
Yeah, ECI, yeah. So your ECI program.
So it's not,
Yeah.
it's, there's no income eligibility requirement, but it's just, it's the way that it is, or I think for most states, is it is based on a score on the
Like a
Battelle.
developmental. Yes, yeah. And then in addition, some states qualify based on risk factors alone.
Oh, that may be true.
Yeah, but not Texas, it seems like. Massachusetts does.
Again, and you're number one in everything, so way to go, Massachusetts.
Just here to plug that. Okay, thanks.
I just want to say one thing about ECI in Texas. Yeah. Texas used to have some of the lowest qualifications for ECI. Okay. And if you compared state by state, Texas was really good. Mm-hmm. But you saw the growth in children in Texas, and ECI is an entitlement. If you qualify, supposedly, we have to deliver services. and it became too expensive. But even though we have more money, I mean, the amount of money for ECI has grown and grown over the years, but the numbers that could be eligible by our previous generous eligibility, we couldn't afford it anymore. So what's happened in our state, we became more like the others. The percentage that you have to be delayed is much greater now. It's harder to qualify, and that's how you deal with those who qualify get services. However, now we've got those kids that once qualified, but we're not serving with ECI. We just have to wait till they get worse. I'm sorry, that's my pitch, and it's not good.
Of that, yeah.
That's
So
absolutely right.
so then is the home visiting program kind of compensating for those kids that aren't? or no?
I
Yeah.
wouldn't.
Or no?
So I think
Yeah.
no. So no, because home visitors are usually not trained in that. Oftentimes they are trained to conduct screenings. So perhaps giving more kids to not be able to be eligible for ECI, but they wouldn't be probably generally for most home visiting programs, the home visitors are not qualified, I wouldn't think would be qualified to provide the level of service needed for those types of disabilities. But for sure, home visiting is helpful in terms of the screening and linking to resources if you're eligible.
Sure.
Dr. Fantastic talk. Thank you so much. So something that you said about daycare kind of get the wheels spinning.
Yeah.
So I wonder if you can talk about kind of the multi-dimensional nature and the different kind of fallouts of these policies, right? So one of the things you mentioned was that they're going to start, cracking down on some of these maybe unregulated daycare programs. But I also imagine that those are the places that certain segments of the population in Dallas go to because they're probably more cost effective.
Yeah.
So if we're removing, I don't know what the cost of daycare is like here, but a lot of
Really
places, it's
expensive.
Really,
Really
it's
expensive.
really expensive. So
Yeah.
how do we kind of, if we're going to regulate these systems more and then possibly close off segments of the population to utilizing those services, then what do we do to kind of mitigate those potential negative effects of positive policies?
Yeah, childcare is so tricky. You're asking the absolute right question, and I certainly do not have the answer. But it's any type of kind of regulation on childcare. So you get a lot of pushback when you want to have better ratios, right? Because if you have better ratios, then you can't have as many children, which means you're going to have to raise tuition. So then is that it's safer but more expensive, and then do you get priced out of the market? That's always pushback. Actually paying our providers even a fraction of what they should be paid. Again, it's that same kind of issue of, well, then I have to raise the cost even higher, and subsidies in the state pay for, cover just the tiniest little fraction of what childcare costs in this state. I don't know, Melanie, I'd be interested to get your kind of input on this, because this is your choir. I'm like, let her talk. Yeah, and we have.
No, so that is a very good point, and it's always a tightrope that you're walking. I will say that I think part of why these policies passed this last session was because there was a huge influx of federal dollars. So it's not a coincidence that some of this happened because there was some more resources coming into the system, coupled with the standards are really still very low. So yes, there is a sensitivity to you don't want to drive anyone out of the market by making these changes, but in the big picture, the changes are pretty small. So it's supporting reimbursement rates just went up pretty dramatically. So there is parallel resources going to providers while at the same time they're cracking down. So they're trying to balance that to make sure that that's not catastrophic to families or to providers.
Yeah, I mean, we could do a lot more to support families in their ability to access high quality care as a state, as a country. So it's such a large, convoluted issue, and a lot of work needs to be done so that we aren't taking away the only option that some families have. You know, in particular, our lower income families who work non-standard hours, who have, you know, shift work that changes day to day, week to week, have no control over their schedules. I mean, those childcare arrangements for those families are often so fragile that, you know, any change can mean that they lose their job. So the problem is huge, and while we are making some steps to help certain areas of the problem, there's so much that needs to be done.
No, just one other point I can't leave unsaid when we're looking at this issue, because it is so important, is that I don't want to frame this as a low-income issue,
No.
because obviously the challenges are exacerbated by it being a low-income issue, but this understanding of what these quality interactions are, or what is good to look for in early learning and childcare, is across incomes, and I just don't want to leave it unsaid.
100%.
Thank you for all the wonderful statistics you gave us. We really appreciate it. One of the things that we try to do here in Dallas was to show the No Small Matter documentary. I'm not sure if you guys are familiar with it. If not, it's definitely one that's worth looking at. It gives some of the statistics that you utilize, but also really talks about this disparity and the issue that you brought up with the high quality early child care. And so I think you know, getting those business leaders to maybe view it from a different perspective, or to be exposed to the information in such a, I think, impactful way that this documentary presented in, might be a way to get them to buy in and to invest in early childcare. And also, I mean, Californians are coming to Texas, but they're also bringing their beliefs of what early childcare education should look like, because they do have it a little bit better figured out than we do at this point, if we can be fair to say that. And so they're going to be looking for those quality care centers. They're going to be asking, is it NACE accredited? Are these Montessori teachers AMI or AMS certified? So they're going to ask all the right questions, which means that will help us hopefully raise our quality and offer what it is that they're going to be looking for when they are paying the $1,700 to $2,000 per month for high quality care. So they're going to expect more from us because they're better versed, I think, too. No Small Matter. The documentary is called No Small Matter, and you can get them to do a screening if you go on their website, and I think it's really impactful.
I think our time's up.
Perfect.
I'm so sorry.
No, that's
I really would love to hear from more.
That's fine. Thank you so much.
Okay, that's good. Yeah. Oh, yeah, one thing to let you all know is that the slides and video of everything that's been going on here today will get posted onto the Center for Children and Families website. If you go to programs and you go down to forum and then you find 2019, it's all going to be there as soon as possible, okay? All right.